We're the part of the health sector which is responsible for promoting and protecting health and preventing illness across this region. And so obviously that's a huge task, and quite a lot of our work therefore is building relationships with those whose work can really help promote the health of our citizens. And so I'm partly here today because to recognise how much councils already do in the health sector by your decisions and your policies and your funding. You make a huge difference to whether our citizens can and how they live healthy lives. And in public health, we talk about the determinants of health. And by that, we mean that how healthy we are is decided partly before we're born by what our grandparents and our parents did, partly by where we live, what parts of the world, what kind of houses, how warm they are, what kind of jobs we do and whether we actually can get a job, how educated we are, and then it comes down to things that we think of as personal choices, but sometimes they're also difficult choices to make. You know, what we eat, how active we are, and of course whether we use tobacco. So in public health, we talk about the importance of modifying the determinants of health, changing the environments so that everyone can live healthy lives. And I think it's important that we remember always that some people are more disadvantaged than others. Some people are better able and equipped to make healthy choices. And so this is a useful picture, especially during the Rugby World Cup. Equality is about giving everyone support. And equity is about sharing that support to make sure that everyone gets to see the game, gets to play in the game. It's about levelling the playing field. And some people are going to need more in order to get in the game. And this is true of many of the social determinants, but it's particularly true of tobacco. Because we've been trying to modify tobacco use for the past 50 years, and we've been pretty successful globally and in this country. But an equality approach to tobacco means that those who are better off get the benefits up front. So I suspect there are very few smokers in this room, and I suspect that we're mostly employed, and mostly our houses are pretty nice, although all New Zealand houses are far too cold. But an equity approach means that we provide extra support to those who need it most. And so who's that in this region? So let's look at the trend of smoking rates. And before this slide, we should remember that since 1983, in 1983, 33% of New Zealanders smoked. And so we've already made huge progress. In 30 years, the national smoking rate has come down. But this is, I don't know if you can see these actually, this is national smoking rates compared to CDHB smoking rates over time. So since 2006, the smoking rate has dropped from about 20% to about 15%. And if we look at the CDHB level, the downward trend has also been matched. And compared to nationally, we have percentage-wise fewer smokers. So it's a pretty good picture. We're making progress, but we still need to do some significant work. And this is a slide which shows one of the places where we need to do work, because this is the same comparison, national data against CDHB data, but by ethnicity. So you can see that although the national smoking rate has gone down, the rates for Māori are still over 30%, and for Pacific it's about 23%. And so the rates over time for Māori and Pacific have remained relatively unchanged. So we've given the box to the most privileged communities, and they can see over the fence. They could probably see over the fence before. But for Māori and Pacific, we need to be doing more work, because we know that ethnic groups have different health profiles and that they suffer more social disadvantage. So we need an equity approach to ensure that they get the extra help they need. What does that mean for the Canterbury region? Although Canterbury has 14.3% of smokers, which is below the national rate, this works out at 52,212 smokers in the region, which is actually the largest number of smokers in a regional area, partly because Canterbury DHB area is such a large area geographically. So if you compare us with Auckland DHB, which has a smoking rate of 11%, that's only 36,000 smokers because it's a much smaller DHB. And if you compare us with the West Coast, which has 22% of regular smokers over a much larger geographical area, but the total population of the West Coast is much smaller. So percentages tell one story, but numbers tell another. And so we've got 52,000 people who smoke regularly in this region. And that's the work that we've got to do, because that's a lot of disease, that's a lot of misery, that's a lot of days missed off work, that's a lot of expensive healthcare. Doesn't want to change. Oh, I'm supposed to have been doing clever things, but I didn't manage to do them, sorry. So this is the cycle of tobacco disadvantage, which you can, it's a hard slide to read, but basically those who are most prone nowadays to smoking tobacco are those who probably have worse living conditions. You know, they live in worse houses, they're more likely to be unemployed, they're more likely to be have poorer education, and those things are stressful and cause poor health. And so one of the ways that people still think that smoking is useful is to manage stress. We know that's not true. I'm looking at Kate. Kate over there will cite many examples and evidence around why this is not true. But it is still a popular myth. And actually, smoking, for all the price has gone up, is still an affordable recreation for some people in their perception. And once you're addicted, we've heard many people already this morning say people don't want to smoke. They want to give up, to stop the next generation from starting to smoke, to make it an environment where people are encouraged to quit and have opportunities to have many to have successful quit attempts. The local authorities have a significant part of the jigsaw puzzle towards Smokefree 2012, and we are looking forward to working with you so that you can exercise your power.